What exactly is unexplained infertility? How do couples, what do they do with unexplained infertility?
Unexplained infertilities have several aspects.
Okay.
When we see egg as an entity, we check follicular study. We see the egg is growing, egg is releasing. We see the sperm, the quality is also accessible. When the sperm quality is all good, when we ask them to conceive naturally, if they don't conceive, we do IUIs, they don't conceive, we do other treatments along with this, and they don't conceive. This is unexplained infertility.
Okay.
So the reason behind infertility is not there. At least you should have some thyroid issue or some egg formation issue, egg release issue, or the lining of the uterus issue, or sperm count quality issue. If nothing is there and still you are not conceiving, even with simple assisting methods, then it's unexplained infertility.
Okay. Is this very common now?
Yes, it has become very common now because the kind of chemistry between the couples is not very good. I still feel unexplained infertility is ruled by stress,
Okay.
because stress is a fight or flight thing. In that mode, your body is just for survival, right?
Correct.
If you see a lion in front of you, you would run away rather than dress up or put makeup
Yeah.
or smile
Yeah.
or talk.
Correct.
Okay, so your body in stress would not want you to become pregnant. So in stress, it runs only basic functions, heart, lung, kidney, and your basic functions in the body. Reproduction is far, far, far off as a priority.
Okay.
So, lot of couples do everything but don't manage stress. They do everything. They don't manage stress. They don't manage sleep. Again, sleep is something that it's free of cost. It gives 100% repair for your body for the next day.
Okay.
People are staying away from it for worldly pleasures. Maybe it's work, maybe it's watching content, maybe it's just scrolling over your phone, maybe partying, maybe traveling, whatever. If you are not repairing yourself, then reproduction is something that is going to get hit.
Okay. So basically, hidden factors like sleep, stress that you can't visibly see in tests.
They don't
these are the
feel it
ones-
is a problem for them because they're so comfortable with it. And people are still living for that adrenaline rush that is given by environmental things. You get a lot of adrenaline rush when you club, you party at a club, because that's music and you're all happy feeling. But internally, your body doesn't need that at that time. Your body needs rest for the day,
Correct.
sleep for the day,
Correct.
hydration for the day, not alcohol.
Right.
So we are doing opposite thing, and we are actually feeling good about it. That is the adrenaline rush which will get you back to the same thing the next day.
So if somebody has unexplained infertility, either due to stress, sleep, whatever it is it reversible? Have you seen cases where they've still gotten pregnant with unexplained infertility?
Of course, yes. I have day in and day out such kind of issues.
Okay.
And even last month I had a couple who were married for 10 years.
Okay.
Unexplained infertility for about 6 years.
Okay.
They were seriously trying, and they were not getting pregnant. Then when they came to me, I just assessed them. I asked few questions, and she in fact is a CEO of an organization, and this person, husband, is on a traveling job,
Okay.
and they've been somehow coordinating things at the moment during ovulation time. But when I took a deeper history, there were issues in terms of, one is the stress, the second one is the sleep, and they were constantly traveling. They were having food at different places, and both of them were borderline diabetic.
Okay.
So 5.7 and 5.9 HbA1c. Then we started off with them in terms of managing and postponing their travels and doing their travel, itineraries online. And for a couple of months, we stopped all their travel plans and online meetings and all we did. And we made sure that they addressed to their food proper home cooked simple dal chawal food types. Okay, so and we just shifted from rice to millets, and we also gave them half an hour 45 minutes of exercise
Okay.
every day. That is to be done together.
Okay.
And bonding is something that we created, spending time. We gave them tasks. In fact, everything, all of these is there in the program. And we gave them tasks and everything. And after 3 months, their HbA1c values came down to 4.9 for the woman.
Just with the lifestyle changes?
Yes, and 4.9 for the woman and 5.3 for the man.
Okay.
And then we always been giving them some antioxidants, vitamins and everything. Then at that moment, there was a little DNA fragmentation that was high, which was corrected. All these things done and set. And then we told them, we will try one IUI cycle because both of them were above 30. And AMH was just borderline, around 0.9. I told, if you are getting a natural follicle and it is releasing, we will just do a natural cycle IUI.
Okay.
And then, because when you do an IUI, your sperm prep is done and your swimming capacity of the sperm increases, motility increases. And all that you do is bypass the cervix and put the sperm inside the uterus.
Right.
So the extent is gone. And some cervical factors, if there's less mucus and all, cervical factors are bypassed. We don't know what it is. So we did that. They conceived.
Okay.
And they were so happy because I assured them that this is what has to be before you plan pregnancy.
Done
Now-
before even going for the IUI.
Now, in this pregnancy, she might not land into diabetes because she's already
Corrected from
corrected her sugars. She lost 6 kg. That's another very important thing.
Okay.
And this pregnancy, the baby is going to be healthier because it's a corrected quality.
Correct.
And we're not going to anticipate a lot more complications in this pregnancy because her BMIs have dropped and she's healthier, she's confident, she's happier. Now bonding is good. They spend time together. That was an issue. As simple as spending time with each other. So, because parenting doesn't happen when you go your way and the other person goes the other way. Parenting happens when you are doing it together.
Correct.
And that is the one thing that is required for the child. When you satisfy your body with that parameter, your body releases everything that it has been closing for reproduction.